It's been 1 year this week since I had my tummy tuck. One of the things that people ask is, how was the pain? How much pain did you have? And I would say that I really did not have much pain from the incision of the tummy tuck. I had more pain from my lower back from being bent over for the first week or two. I didn't take many pain meds, not as many as I anticipated taking. I did have pain from the muscle tightening once my pain pump was removed, which I had for about 5 days. Once that was taken out, I did off and on for probably 3 or 4 months have a little bit of pain from the muscle tightening, but never really from the incision. One of the things that people said was that it was going to be so painful. That made me not want to do it, but now that I did it, I really didn't have much pain, and I'm really happy that I did it. I look so much better in my clothing. I don't have that mid-roll around my midsection that I used to have. I'm happy with the whole thing.
How about the scar?
At first, when I first took the
Steri strips?
Yeah, the strips off, or when I first saw it, I was a little horrified because I thought, oh my God, that's a huge scar, because I had a big tummy tuck from hip to hip. And I thought, oh my God, I'm going to have this scar. It's going to look awful. But now it's almost pencil thin. I have worse scarring from my stretch marks. I have stretch marks that are bigger than my abdominal scar.
Well, you also have scars from your previous gastric bypass, because you were done many years ago when they did them open. And those scars are worse than the ones that we made from the tummy tuck, probably. But
yeah, for sure, the scar from my abdominoplasty, not my abdominoplasty, I'm sorry, from my bypass, my gastric bypass, the first time, are much worse than my abdominoplasty scars.
And they mature, and that's one of the key questions or key issues for patients, is the belief they're going to have this horrible, horrible scar. And you were also good about wearing the silicone sheeting that we talked about, and doing various and sundry scar minimization things, keeping sunscreen on it, even under your clothing, and all those things help the scar mature nicely. It also has a little bit to do with how it's done. I didn't leave a whole lot of nylon in you or anything.
I also had one thing that most patients don't have, which is constant doctoring, since my husband is the one that did the procedure.
Yeah, that's actually good for your surgery, but it's lousy for your psyche. I make you into a psychological mess, but it actually worked on the wound.
Yeah, he was looking at me much more than he normally sees patients, which is one of the reasons why I tried to be as compliant as possible, because I thought, here we have a chance to videotape every single step by step, day by day, minute by minute of a tummy tuck, and I should do the things he asked me to do, considering he's going to be able to show other people and just try to get the best result I could get. So that's what I tried to do.
Okay, final question, weight gain. The news right now has reports of various people saying that you do this operation and then you gain weight in other places and other things happen, and ultimately, what's your overall assessment of where you sit weight-wise before we did it and now that we've done it a year later?
Well, for me, I did not have an issue with weight at this point in my life because I'd already had a gastric bypass. So for me, the surgery was basically to remove the excess skin that I could not exercise away. I couldn't do anything with the skin. So we removed all that skin. As far as weight gain, I did probably gain a few pounds, I think, and I did not come back to the midsection. I would say that it came a little bit more on the thighs. I'm not sure if it looks bigger because my waist is so much smaller now, or if it actually did get bigger, because now I'm actually looking at the pictures today that we just took, and I look better than I did before. So maybe it's just because my waist is so much smaller, but I think I did have a few pound weight gain.
CosmeticSurgeryTruth.com. You would have to be crazy, crazy, crazy to go anywhere else.